what sort of age do I need to start thinking about my hormones and menopause?
Well, it's interesting. In primitive times, before we had manufactured food and before we had pesticides and before we had everything, women were actually dying in their 40s. And those that survived the 40s, because they died because of infection, but if they survived, they went into menopause around 45 or so. Now with our improved nutrition, we find that they're going into menopause both later, like 50 plus, but also their fertility is changing earlier, like 37, 38, 40. The fertility drops down, the hormone level drops down, and the ovarian function drops away, which is why it's hard to get pregnant in those late 30s, early 40s. And that's why IVF was developed, because the fertility rates have dropped down in those years. So potentially you can have an early menopause from 35, but a lot of women will be already established with hormonal changes by then, and certainly by 40 they may not be fully menopausal till they start missing a few periods. They miss one and then they miss 3 together and so on. But in biochemical terms, they're not really menopausal until their FSH, which comes from the pituitary in the brain, goes over 50. Now, the laboratories will tell you that over 30 is menopausal, and they're correct, but it may not stay over 30. Whereas once it goes beyond 50, 75, 100, it's not going back. But the FSH can go up and down, because sometimes the brain is shouting at the ovaries and putting out a lot of FSH, and all of a sudden they get a response. So then the FSH calms back down again. So it's not sure to have stayed up until it's well over 50. And you can't assure a woman of her lack of need for contraception until it's over 100, to be on the safe side.
If I come to you and I'm experiencing changes like my periods have become
Erratic
and quite erratic, what other symptoms if that hasn't happened, what other symptoms would I be looking for?
Well, women notice, they come through the door and they tell me, my periods have become crazy. I'm dropping some, and then I'm bleeding too early, and then they're painful, and there's a whole lot of symptoms around the bleeding. And there may also be symptoms of mood changes. One woman said, I'm like a tiger. You cross me and I'll pounce on you. And she said, my family are just over it. And that can happen. Then they notice that their libido has dropped down, and they notice that their dry vagina has occurred. And they start feeling like their mothers and getting into an awful state of panic that they might actually have ceased to be a woman. So I try and reassure them that it's just the hormones bucketing around until they settle into a postmenopausal pattern. But that might happen over a period of 5 years. It isn't just a one date on the calendar when you become menopausal. It's a whole process involving your moods, involving your fitness, involving your energy levels, involving your periods, of course, but also importantly involving your sex life. And all of those things can be part of menopause.
And when you talk about the hormones, specifically what hormones are we talking about?
Well, hormones are defined as products of glands that have no ducts. Now, there are a lot of glands in your body that have no ducts, but everyone's familiar with salivary glands that have ducts, and they make their juice and they pour in the mouth, and they make their juice, they pour in the mouth. Other ducts with plenty, there are other glands with plenty of ducts around the body, but there are a whole collection, a little orchestra of glands that don't have ducts. The pituitary in the brain, the adrenals on top of the kidneys, the pancreas. Now, pancreas is a mixed gland because it has a duct, but only for some of its product. The rest of its product, insulin, just goes straight into the bloodstream. And of course, the ovaries and the testicles. And if the product of the gland just goes straight into the bloodstream, that's a hormone. But when you and I are talking in the surgery about hormones, what we really mean is the sex hormones. Everyone uses the term hormone to mean sex hormone. But I'm just drawing the difference between the medical definition and the lay definition. But if we're going to talk about the lay hormones, they talk about sex hormones. So we're talking estrogen and testosterone. Both male and female have both, but in a different proportions. And you talk about DHEA, which is a precursor hormone, makes some of the others. And you talk about SHBG, which is a carrier hormone, to take the hormone to the site and take the waste product away. And you talk about FSH, which comes from the pituitary to set the ball rolling. No pun intended. But those hormones are sex hormones, and they become very unbalanced at menopause, partly because the ovaries don't respond as quickly and snappily as they have always. And so the FSH goes up and up and up and shouts at the ovaries to get a move on and get an egg out. And sometimes the ovary will do that. So here and there, after 5 or 6 months of no periods, this woman will have a period because her ovary has responded. And so you'll find people very disappointed. They've thrown away all the tampons and got rid of all the pads, and then now all of a sudden they've had a period again. It's kind of like they say, oh no, do I have to go through all this again? But no, it's just that their ovary has responded to a high FSH. But that won't go on. The ovary runs out of juice and runs out of ability to respond. So we're really talking about the sex hormones when we talk about hormones.
Can you prevent the symptoms of menopause?
You can't prevent menopause, but you can ameliorate the symptoms. It would be against nature to try and interfere with menopause. And I really disapprove of a common habit of putting menopausal women on the pill. And the logic seems to be, well, at menopause you have very little estrogen. The pill contains a small amount of estrogen. We have a lot of experience of the pill in premenopausal women for contraception. We know it's safe, so therefore we'll give menopausal women the pill. No. Nature has designed women to stop needing and responding to estrogen at a certain time in their life. And yes, they will get some side effects because the receptor sites are still actively looking for estrogen. They haven't quietened down. And so the pill will ameliorate some of the symptoms, and a lot of women think it's deferring the menopause. But it's actually the wrong estrogen. It's ethinyl estradiol in the pill, which is a synthetic. It doesn't fit into the receptor sites. It sits on top, and the body treats it as a waste product. It shuts them up. You know, it stops the women complaining of hot flushes, but actually it does them no good whatever in the longer term. And usually the pill contains synthetic progesterone as well as synthetic estrogen. So why are you loading your body up with these synthetics when you could deal with it naturally? And if you can deal with it naturally with hormones identical to what you've always had for 30 years, surely that's got to be a safer option. We know your body can cope with it. Now, having said that, even natural estrogen should only be taken for a maximum of 5 years. Best practice guidelines say that it is safe to take estrogen for 5 years when you hit menopause. But you shouldn't be taking it for 10, 20, 30 years, as some women have. I had a woman in the other day, she's 73 years of age, and she has been on estrogen HRT since she was 33. That's 40 years of tablets that she should not be needing, and she's terrified to come off it now in case she gets her hot flushes. I said to her, baby, your hot flushes are long gone. You need to get off the tablets. Don't take them long time. Gradually she's getting confident to come off, and she's fine. You know, she will be fine. But it's very bad practice to keep people on A, the pill during menopause, and B, for longer than 5 years of any form of estrogen is not good.
Why would you stay on estrogen, or why would you be recommended to stay on estrogen for longer than the 5-year period?
There are 2 reasons. The first is that when estrogen was discovered, it was considered to be the hormone of youth. So in that 73-year-old woman's generation, she was young when it was discovered, right? And this is the youth hormone. This is what we need to stay young. Young women have lots of estrogen. Give me that. You know, like that was the idea at the time. It was the youth hormone when it was discovered in the 40s. And so although it wasn't widely prescribed as a youth hormone, women liked it because they thought that would keep them young. And because it helps lubricate the vagina, it did make them feel as though they were a bit younger, right? However, it is a very bad idea because of the effects on breast cancer. I mean, there are umpteen studies to show that it has negative side effects, and don't ask me to go in there, we'll be here all day. But there are plenty of studies to back up the best practice guidelines of 5 years, and that's only. So it was first of all considered to be the youth hormone. Secondly, women are terrified of hot flushes. Some women suffer dreadfully, others don't suffer so much. Actually, the more body fat, because estrogen is fat soluble, and if she's carrying a bit of hip or thigh fat, she may not actually suffer the hot flushes that some other women do, because she's got some stored estrogen, right? And it releases gradually. But if a woman really has dreadful hot flushes every hour and she's fanning her face and pulling her clothes and they don't want to go back to that. So if they've got a pill that they know has fixed it, they're inclined to keep taking it unless somebody calls a halt and stops them. And I've had to call a halt and stop a few. I said, listen, if I wouldn't take it, you're not going to get it from me. So I wouldn't take it for more than 5 years.
So I'm new to this whole thing. I phone you up and make an appointment to come in and see you, and I'm suffering some symptoms of menopause. What is going to be the process? Like, what's the stage of us treating and dealing with natural? Well,
first of all, we have to establish where you are on the continuum of menopause. You're either nowhere near it, your FSH is quite low, your estrogens and progesterones are rolling along like every cycle, they're all the same, or you're way past, in which case you've got no estrogen and we've got a whole lot of other things, and somewhere in the middle there's a continuum of menopause. We need to know where you are on that continuum. Are you just starting? Have you almost finished? What stage is how do your hormones correlate with your symptoms? Let's see how much you've got of what you've got, right? And what a lot of people don't understand is it changes. And it changes not necessarily related to symptoms. Now, some people they test once, and then they manage the hormone therapy, natural or otherwise, by symptoms. But the truth is, it actually buckets around quite a lot, and the symptoms are not a very good guide. So when I start off, you come to me, we'll say 41, and I do the hormones, and I say, oh yes, you're approaching menopause, this is where this is going. You do or you don't, depending on the results, need anything, and then we'll retest you in 3 to 6 months. And then in 3 to 6 months, you'll see, because you have the readout, you'll see the progress. And you will see quite a dramatic change. You will understand your body is going through this change. And at some point in that continuum, we will intervene if your symptoms are bad. And we'll say, yeah, right. Well, your estrogen's dropped right down to bedrock, and that's why you're having the hot flushes now that you weren't having back then. So we'll replace your hormones. But you only get what you need. If your estrogen is down, you get a little bit of that. If your progesterone is down, you get a bit of that. If your DHEA is under 1,000, or I don't usually treat it if it's 800 or 700, but if it's down at 200 and 300, I'll give you some DHEA because it's good for energy. And so on and so on. So you get a map of where you are, and you get the ones you're missing. And then we re-examine it in 3 to 6 months, depends on how much change we've put into the prescription. And then we tweak it again to keep you right. But at the end of 5 years, we wean you off the estrogen, because by then the progesterone will have kicked in. A certain amount of progesterone converts to estrogen, and the progesterone takes over the role, so you don't have to have estrogen. And that's why women at a certain age no longer have hot flushes. Their receptor sites have calmed down, and the progesterone has taken over, and they don't need it.
How long can you take the hormones for? I know that you've already said that estrogen's 5 years.
Yeah. Estrogen is 5 years post-menopause. Once you hit that menopause thing, 5 years of estrogen, that's it. And on your record at my clinic, you'll see stop the estrogen in 2011, 2015, whatever the date is, right? But progesterone can be taken longer term because it's an anti-proliferative hormone. Estrogen grows stuff. It grows eggs, grows the lining of the womb to take the egg. It's a grower, right? So it isn't good to have it running around affecting all the cells that you don't want to grow, right? We all have a couple of little odd cells that we don't want to grow. But progesterone appears to be an anti-proliferative, so that it calms down all the growing. It stops the lining of the womb excessively. It stops another egg growing. It stops. That's what progesterone does. And so progesterone can be used longer term. It has beneficial effects too. It seems to ameliorate the moods. A lot of women say they were a bitch beforehand and the bitch has gone. The very words they tell me. And the second thing is you can get an increased bone density from progesterone that you can't get from estrogen. Estrogen will give you a slowing down of the destruction of bone that happens in middle age, because the old bone is destroyed. But estrogen slows that down to leave more bone in the structure, but progesterone actually actively promotes the laying down of new bone. And I've had patients whose bone density has improved by several percent just on progesterone. So it has a role as you get older.
Oh, well, thank you very much for
That's
that.
very good. You're welcome. We'll meet again next time.
Okay.